Hello and good morning, everyone. Welcome to the Oregon Universally Offered Home Visiting Stakeholder Update webinar. My name is Erin Dean. I'm the statewide coordinator for Healthy Families Oregon, and I work in the Early Learning Division at the Department of Education. I'm going to provide some updates today, and we're going to hear from some community partners. So thank you for taking some time out of your day today to join us. The purpose of today's webinar is really just to provide everyone who has some interest in this work an update on the latest information on what's happening, kind of where this work is going and what's happened so far and where we are headed. Here's a quick just list of what we will go through today. Do a couple quick introductions and some housekeeping. I'm going to provide a brief background on what is universally offered home visiting. Where are we now here in Oregon? What point are we at now? And then we're going to hear from two of our early adopter communities. We're going to hear from our Eastern Oregon Early Learning Hub, as well as our Washington County Public Health Department on the work that they've done thus far. And then we're going to have a little bit of time at the end for some questions, and we'll wrap up in just about 1 hour. So for some introductions, again, as I said, my name's Erin Dean with the Early Learning Division, and I work with the Healthy Families Oregon program. Today we're also going to hear from Kelly Poe. She's the Early Learning Hub Director in Eastern Oregon at their Early Learning Hub, and then Rebecca Collette, who is with the Washington County Health and Human Services Department, and their Early Learning works very closely with their Early Learning Hub as well. Some just real quick housekeeping. Please type in your questions into the chat box. If you have questions, we're going to save them to the end, we'll get a chance to get to all those questions. So just go ahead and type them in as you have them, and we have people monitoring those questions, and we'll go through that list when we're all done. So first, I'm going to start with just a brief background on what is universally offered home visiting. Universally offered home visiting is an initiative to strengthen families by offering voluntary home visits to all families after the birth of a child. This visit is done by a nurse as well. Why is this something that people would want to consider doing? We all know that the birth of a child is such a beautiful thing for families, but it can also be a really stressful time as well, welcoming a new baby into the family. For all families, regardless of income or risk factors, we know that the transition of welcoming a new baby can bring various stressors and connections to communities that are needed, and families might not know how to do that. And so this is an opportunity to provide that support to all families. So what are some of the goals of universally offered home visiting? One of the first goals is to create and strengthen community-level systems of care for families with newborns. We're offering support to all new parents in Oregon, and all is that key word there, regardless of risk, insurance, income level, that this is something that we could offer to every family across our state. Increasing access to community services and supports. Lots of families might not know how to access certain services, and having someone come meet with them right after their baby is born is a really great way to provide some resources and get them plugged in where they might be needed. This work can also promote collaboration and coordination across Oregon's early learning, childhood, and home visiting systems. I think that we've already seen a lot of that happening so far in the short amount of time this work has been going on, and it has been really great to see. And then another goal is improving health outcomes for families across the course of lives. And so by connecting families early and providing resources that they need, we know that will help improve health outcomes. The Family Connects model is a model that universally offered home visiting work in Oregon will be using. And there are 4 key components that we wanted to call out. One is that it's for everyone, as I've said a couple of times, regardless of income, background, risk, insurance. This is a service that will be offered to everyone. The first home visit happens around 3 weeks after the birth of a baby. Most families have 1, maybe 2 visits, and there's an option to have even 3 visits for families where that is needed. There's no cost to families for the service, and all home visits are made by highly trained registered nurses. If you'd like to learn more, this is obviously just a very general overview. If you'd like more in-depth information, there is a recording from the last webinar at this link. I'll leave it up here for just a second, that you can go onto YouTube and watch this webinar that has more information about the Family Connects model. Slowly press my button so you can write that down if you need to. And so now for some updates for where are we now in Oregon? What work has been done thus far, and where are we at? So currently, Oregon Health Authority is in the process of hiring 4 new staff to really be dedicated to this work. So there's a public health nurse consultant, health plan integration specialist, research analyst, and administrative support positions. Up until now, there have been no positions that have been solely dedicated just to this work. So this is really exciting to have more capacity focused on this work. We're also in the process of making some rules for this work. Senate Bill 526 directs Oregon Health Authority to design, implement, and maintain the voluntary statewide program that provides universal newborn nurse home visiting services to all families with newborns. It requires the health benefit plans to cover nurse home visiting services to enrollees with newborns without cost sharing. So we're in the process of doing that right now. The Oregon Administrative Rules will be created to outline regulations, procedures, and standards of implementing Senate Bill 526. So the OARs are currently being drafted and refined with input from the Rules Advisory Committee. We're expecting the draft rules to be posted mid to late December, and a public hearing into 2020 in January. And the rules are tentatively hoped to be finalized in April and then effective the following January 2021. So this is a list, it's a list and a map of the early adoption communities in Oregon. You may or may not remember that late last spring, there was an application process identifying communities that were eager and excited and willing and wanting to be the early adopters for this work, the first ones to get it going. And we are so excited for all the work that's happening in these communities. So we have our Clatsop County Public Health, the Early Learning Hub, Lynn, Benton, and Lincoln counties, the Central Oregon Early Learning Hub, Baker and Malheur counties with the Eastern Oregon Early Learning Hub, Four Rivers, which is Hood River, Wasco, Sherman, Gillum, and Wheeler counties, Lane County Public Health, Marion and Polk Early Learning Hub for Marion Polk counties, and then Washington County Public Health Division for Washington County. So you might be asking, what happens with these sites that are our early adopter sites? What is the work that's going on right now with these sites? Family Connects International is working directly with each of these communities through regular phone calls, in-person visits, and attending meetings with the lead agency in their community. All of these communities are in the middle of their planning stage. So this first year has really been dedicated to planning. They're pinpointing really within their community what are their strengths, what are their needs, and really figuring out together as a team what's the best path moving forward for that community. And it's going to look different in different areas. Identifying also who are the partners that they need at the table, whose voice needs to be there, who needs to be involved in this planning process. And as I said, every community is different, has different needs, has different resources. So their timeline is varying from location to location. So first, this is our early adoption community for Eastern Oregon, and it's Baker County on top in the green, and then Malheur County. And so we are going to hear from Kelly Poe from the Eastern Oregon Early Learning Hub, and she's going to tell us a bit about the work that they have done in Eastern Oregon so far.
Good morning, everyone. This is Kelly Poe. I'm in Ontario today, and I'm sitting with Rebecca Stryker, who is our registered nurse at the Malheur County Health Department. And we are going to give you a brief update on what's going on in Eastern Oregon. So I just want to check and make sure you can hear me.
Yep, I can hear you, Kelly.
Okay. So if you'll notice this geographic region, it is quite large, but you'll notice that our early learning hub is missing one county. We also serve Wallowa County, which is the northernmost county that's not highlighted in green. And so we cover the eastern coast, as I call it, the eastern coast of Oregon from Washington to Nevada. We chose the geographic region of Malheur and Baker counties because of the health departments and the birthing hospitals have both demonstrated readiness. So the early learning hub is leading the beginning phase, the planning phase of Family Connects, with support from the health departments, and universal home visits will begin probably in April of next year, and I'll tell you a little bit more about that. Our goal is to eventually move into Wallowa County, but currently Wallowa County does not have a public health department. We have some good partnerships up there with Winding Waters Clinic, and there's some other positive things. So we don't think that that's going to be a barrier in the future, but we're going to start in Malheur County, move to Baker County, and then eventually move into Wallowa County as well. So we have two birthing hospitals in our defined catchment area. They are both St. Alphonsus Medical Center. One is in Ontario and one is in Baker City. They are the only hospital-based obstetric centers in these counties, and they're both strong partners in our plan. So at our public health here in Malheur County, we work with Sarah Poe, who's the director, and with Rebecca Stryker, who is the supervising nurse, and then we also work with Nancy Staten in public health in Baker County. So our local advisory groups are Cradle to Career partnerships in each one of the counties, and Ashley Alvord has been with us and met once for our initial kickoff meeting. We met with the Cradle to Career Partnership here in Malheur County. What's currently going on that is creating some movement is the Public Health Department in Malheur County has met with Valley Family Health. Valley Family Health provides a women's clinic and a pediatric clinic in Malheur County, and they work together with St. Alphonsus Medical Center. They are going to be our first partnership to do a soft launch as soon as April. We're going to start small, but we also think that as soon as the birthing hospital, St. Alphonsus Medical Center, sees us offering home visits through Valley Family Health, we're also going to be offering very shortly, very quickly after that, with the Snake River Pediatrics, which is the St. Alphonsus Medical Center Pediatric Clinic. So we think that Malheur County is going to move quickly into the home visits and the referrals through our partnership with the public health, with Rebecca Stryker offering those visits through the birthing hospital. Ashley's coming next week to train with Valley Family Health and then meet again with our Cradle to Career Partnership and the Health Department and the Early Learning Hub. And we'll start putting the Family Connects agency finder structure together. And we're going to start figuring out how those referrals are made. And it's really going to help us with our partners when she's in town. It always does. One of the, I would say the biggest opportunity that we have here is that we have St. Alphonsus Medical Center in both of our counties. That's one of our big opportunities. Along with that comes a challenge that a lot of our births that we see in Malheur County, actually the birth occurs in Idaho, and a lot of the births, and I shouldn't say a lot, some of the births in Baker County occur in Union County. So the partnership across those county lines is part of our challenge. I don't think it's going to be a difficult challenge, but it is going to be a system challenge for us. I would say that our biggest challenge right now with Family Connects is all of the system changes that are going on in the state of Oregon around early learning. And as much as I feel a lot of pressure on these deadlines, especially with the early care and education sector planning that's occurring right now with a lot of deadlines, I would say this is probably our greatest opportunity. So if we didn't have these deadlines, I don't think that we would have as much movement around Family Connects and the involvement with our community partners for supporting home visiting. So where are we now? So right now, Malheur County Health Department and Valley Family Health are agreeing to the soft launch in April. They've already met and started that agreement. When Ashley's here next week, Ashley will also meet with Valley Family Health and we will start working on those logistics. And again, I think that St. Alphonsus Medical Center in Ontario and their pediatric clinic are going to want to join as soon as possible after that. I don't think that's going to be a difficult outreach. We already have the relationships in place to make those referrals. So I think our next steps in this process is scheduling our training in North Carolina. I think that that's where right now our team is just really anxious to learn more, see what we're missing, become experts in this project, and be able to lead the effort in these two counties. I think that's all I have.
Thank you, Kelly, so much. It's really great to hear about all the work that's happening there. So next, we are going to move to a presentation with Rebecca Collette from Washington County.
Hi, everyone. It's so exciting to hear what's going on in Eastern Oregon. I'll be honest, we're moving a little bit slower in Washington County. Washington County is geographically and culturally diverse with close to 600,000 residents and about 6,500 births a year. We have 3 birthing hospitals in our community: Tuolity Hospital, Kaiser, and Providence St. Vincent's. Even with our county's large birth population, the decision to be an early adopter was pretty easy. For the last several years, our home visiting network and perinatal resource and referral service, which is named Early Connections, has been trying to develop a plan to offer at-birth nurse home visits, specifically really focusing on the families that may have been referred to or interested in receiving home visiting services, such as through Healthy Families or Nurse Family Partnership, but may have not met the eligibility criteria. Over the past several years, we have also been engaged in developing a coordinated referral system and recently reached an agreement to merge Early Connections, our perinatal referral and resource and referral service, with Help Me Grow in a pilot project to collaboratively provide a welcoming entryway and service navigation supports for families prenatally through early childhood. It made sense with all of these developments around programs and systems in Washington County to go ahead and move forward with Family Connects and align and leverage our current efforts, desire, and motivation in our community. Washington County's early adopter application and initial planning efforts have been a collaborative effort between our Public Health Division and Early Learning Hub. The Family Connects planning and community alignment process have since expanded and are embedded in our Prenatal Child and Family Support Network, which is the slide that you see right now on your screens. Quickly, what is entailed in this Prenatal Child and Family Support Network, where Family Connects is embedded and much of our planning is included. We have an executive committee that provides oversight and stewardship of the overall network, including strategic planning, policy, and systems development. A community advisory board that provides programmatic oversight and quality assurance for programs serving families and children prenatally through early childhood, about until the age of 5 years. A learning collaborative, which is a broad community network that collectively provides opportunities for sharing, learning, and acting through brief informative presentations, reviewing qualitative and quantitative data trends, engaging in systems thinking, and collaborative problem solving. We also have a developing referral network that provides service triage and support for families with complex needs and works to address local challenges and barriers to accessing services. And this entire structure that you see on the screen has been in development for about the last 2 years. Next. The executive committee has been leading our community alignment efforts and consists of representation from multiple divisions in our Department of Health and Human Services, including public health's maternal, child, and reproductive health and WIC programs, children, youth, and families early learning and parenting together hubs, and human services behavioral health section. Our intent is to expand representation on this team to include additional stakeholders, such as partners from our medical providers, our CCOs, and community-based organizations. Next. We also have a community advisory board. The community advisory board provides programmatic oversight and quality improvement for all of our P3 programs in Washington County, which includes Healthy Families, Nurse Family Partnership, Help Me Grow, and Family Connects. The Community Advisory Board has been in existence for many years and has recently undergone some changes to expand oversight to Help Me Grow and Family Connects. We have also recently developed a charter to address some of these changes and assure that we have diverse and consistent membership on our Community Advisory Board. The Prenatal Child and Family Network also includes representation and engagement from a multitude of community partners, all involved in the community alignment process for Family Connect. Some of these organizations include Community Action, LifeWorks Northwest, Youth Contact, Adelante Mujeres, Northwest Regional ESD, OCDC, our schools, libraries, our CCOs, our hospital systems, medical and behavioral health providers, and our home visiting programs. So some of the accomplishments that we have in the last couple of months, I often have to remind myself that we've really only been doing this for a few months now. We had an early learning Family Connects kickoff with our learning collaborative, a countywide medical and healthcare provider Family Connects kickoff, multiple listening sessions, strategic planning sessions with our maternal and pediatric medical providers, as well as the expansion of our Community Advisory Board and charter to include Family Connect and medical and healthcare providers. But even with all of these accomplishments, we have also had some challenges. Next. Some of the challenges we have faced include underestimating the capacity needed for the community alignment process in a county our size. Currently, we do not have designated staff solely committed to Family Connects yet. Hopefully that will happen in the near future. The responsibilities have fallen on county and community partner champions to engage the community in strategic planning. With this limited capacity, it is challenging to maintain the momentum and the community's excitement. The community alignment process has brought to light the need to address and break down additional silos, as well as the need to carefully construct systems of communication in a manner that avoids creating new silos. Overall, our community is very motivated and excited for Family Connects. However, a few concerns have been frequently voiced in the planning process, which many of us have heard this, but it continues to surface as we engage in the community planning process. These concerns include whether we will be able to develop a culturally diverse workforce and if the services will be culturally responsive, as well as if there will be enough services to support families if the need arises in the Family Connects visit, especially in relation to behavioral health supports. So where are we now? Well, the planning continues. We are developing an extensive map of the perinatal services in our community, developing clear referral pathways and communication strategies, developing a logic model, and developing our operations model or models. These models may look different according to each hospital system and will include strategies to engage families that do not have their baby in a hospital setting. We are hoping for a soft launch and to begin offering services in July of 2020. Next. We have an upcoming opportunity if there's anyone interested in joining our efforts in Washington County, November 14th from 12:30 to 2:30 in Hillsborough. Or if you have any questions or want to get involved in another fashion, please feel free to contact me or Jessica Nye. Our emails are up on the screen.
Rebecca, thank you so much for telling us about all this great work that's happening in Washington County. You know, we're all excited to kind of hear from each different early adopter area and what is happening and kind of watch this incredible work unfold. So thank you and Kelly both for sharing with us today. Really appreciate your time. At this point, I think that I'm going to shift over to Derek, who I think is maybe is keeping track of any questions that have come in, and we can have a time for some questions.
Yeah, right. Right now we've got one question. And our question is Eastern Oregon talking to their CCO about this program? So we've got a question for Eastern Oregon, and I'll unmute all of our panelists.
Yes, actually we have our early childhood representative from the Eastern Oregon CCO, Tammy Pierce, is on our team. She lives in Baker County. She serves our region. She also serves the Four Rivers Early Learning Hub region. So I know that I assume she's on that Family Connects team as well. Yes, thank you for the question.
So we don't have any other questions typed in. If anybody has any questions, you're welcome to submit those through the chat box for any of our early adopter communities or for Aaron. Okay, we've got another question. How will billing for services work with commercially insured families? Who will pay for visits to uninsured parents?
Do you want me to take that one?
Sure.
Okay. Good morning, everyone. This is Kate Wilcox here in the State Public Health Office. That's a really good question, and it's a question that we get almost daily, and that we are grappling with daily too. We're working on the rules to help to define sort of how the commercial health plans will interface with this program. The actual billing is something that we are still working with the commercial plans on what that will look like. We'll also be working closely with each early adopter community because it might look different in each community. But the rules will also help govern that. We know that there's a big data piece, the whole how do you bill piece. We're actually hiring one of our staff people. This will be their sole part of their job will be the health plan integration. So while we don't have answers at this moment, we are working on moving towards that. In terms of the uninsured, when you think about the client is the infant, and so all infants that are born in the U.S. are U.S. citizens. There will probably be very few that are not documented for whatever reason, and we have enough of the general fund set aside to be able to support those services. But the Medicaid mechanism for now, as we've talked about in other webinars and places, is using the targeted case management mechanism for reimbursing on the Medicaid population. So I think the local public health authorities are very used to using this. We use it with our other nurse home visiting programs. And while ideally we would like to have all health plans, including the CCOs, be a part of how these services are covered, we're moving there. We've got some ways to go in terms of how that rolls out. But so to bridge until we get to that point, we are using the targeted case management.
Thank you. So we've got another question. Will the slides be available? And I can handle that one. So on your screen, there's this email address. If you'd like to be on our distribution list, most of you probably are, as you've probably heard about it through this distribution list, but you can always contact us too with questions at that email. We will send out the slides to that list, so you should all get the slides for this. We've got a couple more questions coming in. So we have the question, what is the anticipated cost per child or family that is visited?
That's a good question. I can answer that per our learning with Family Connects International, and Ashley and Jeff, if I miss anything, please chime in. The estimated cost based on the evidence and the research that Family Connects International has done across lots of different communities across the U.S. is between $500 and $700 per birth. So when you think about that, the financing of it, you have to think of the total birth population within a community. We also know that within that, about 70 to 80% of families will actually accept the services. But in terms of planning for what it takes to implement the program, it is the service delivery component of the program, I should say. It's about $500 to $700 per birth.
Thank you. Our next question is, how will counties interface with other home visiting programs, such as Cocoon? Are all public health nurses being engaged and updated on Family Connect's efforts?
Do you want to take that one?
Sure. I can try. Hi, this is Anna Stevebutter. So I work in maternal and child health here at the state and help to support some of the public health nurse home visiting programs. Cocoon, specifically, that was mentioned, was supported out of OHSU, but we work closely with them. So the idea is that this Family Connects, the universally offered home visiting initiative, will come into communities and help create a system of care around home visiting and supports for early childhood home visiting, including the other public health nurse home visiting programs. Some of those, like Nurse Family Partnership, engage families prenatally. Babies First is working to do that too. So some families may already be connected with those programs and may not need a Family Connects home visit. Some of them may not have received the public health nurse visiting services going in, but during the Family Connects visit sort of recognize a need for ongoing services and could be referred into programs like Babies First and Cocoon. As far as if local public health nurses are being engaged and informed, yeah, I mean, I think I'm trying to do our best to get this information out to all our stakeholders. We definitely recognize that local public health and the public health nurses are an important, our key partner in this. So we are doing our best to keep people informed, and we welcome sort of feedback if you have ideas about better ways to do that.
One other comment, thank you, Anna. The statute actually requires engagement of the local public health authorities. When we set out to solicit interest for the early adopters, we specifically offered it just for simplicity and the learning portion of this, that a local public health early learning hubs or tribes would be the applicants. So, and with that, there was a requirement that both the Early Learning Hub and local public health be engaged in the process. So to the extent that local public health is at that table, we're trying to assure that those nurses also are understanding, or at least touching, if not being engaged in the community alignment piece at that local level. We also recognize that this is part of a system of care, of a system of home visiting services. So while some families engage early, this is a point where we can engage those who aren't engaged to offer these services, some of which will take additional home visiting services, and others will just need other types of referrals, and some might not need any referrals. So it's just an opportunity to connect, have the opportunity for all families to connect with services regardless of, not regardless, but based on their needs and desires.
Thank you. We have a couple more questions. Do you have an anticipated date for private billing to take place?
This is Anna again. I mean, our goal, and this is sort of through the rules process that Erin mentioned in the earlier part of the slides, is to have the rules effective January of 2021. And the rules would require the health benefit plans to reimburse for the services. So that's the goal. I think there are a lot of questions about the exact mechanisms and how that's going to happen, but that's what we're hoping for.
Thank you. We have one last question. Can you give us an update on how the nursing workforce will be developed or promoted in nursing schools or acute settings?
Do you want to take that one, or do you want me to?
I can try. I can start. This is Anna again. That's a great question, and we have been contemplating that ourselves. There's a few of us here in the maternal and child health section of public health that are nurses, and we started kind of starting discussions with folks like the Oregon Nurses Association to help us think about what we can do to support the nursing workforce for this program, including talking about how we could get nursing schools involved and acute settings. Yeah, that's come up too. Like, I mean, that was sort of, I think that maybe Mauser would be a good person to speak to that. It sounds like their plan is really around engaging at this point their health centers and a pediatrics clinic. So that's a good example of how people are thinking about working with the acute care setting.
Just to follow up to that end, we recognize that community health work is different from being in an acute or ambulatory setting, and part of certifying the service provision, there is training that happens for those nurses that will be providing the services. Initially, those nurses will be traveling to North Carolina to get their training, but as we build up our capacity in Oregon and programs, the communities roll out the program, we might be able to provide that training within our state, kind of doing some collaborative learning and training across different communities that are farther along the journey than others.
This is Kelly. I'll chime in just a little bit. Just thank you very much for bringing out this challenge, because it's a huge challenge for us in Eastern Oregon to recruit nurses, period. So just to have nurses in our public health settings is a difficult challenge for us. So just that this project is highlighting that and bringing more opportunities to Oregon for training and recruitment of nurses, especially public health nurses and home visiting nurses is a huge need for us. So thank you for doing that. We don't have the capacity or the infrastructure on this side of the state to do the kind of work that you can do on the west side of the state. So that's one of the reasons why we like to be part of these statewide systems and these statewide initiatives, is because we don't have those resources available to us. So we see Family Connects as an opportunity for us to grow that capacity.
Thanks, Kelly.
Okay, we have no further questions.
Give it a few minutes just in case something sparks up. Ashley and Deja, did you have anything that you would want to add from the Family Connects perspective?
No, I mean, well, the first thing, this is Ashley Alboard with the Family Connects program, and I'm here with Deja, our new implementation specialist, who'll be working in Oregon. So we can say hello and thank you for participating.
Hi, everyone.
I just want to say what a pleasure it has been to work with all of the early adopters, and I really appreciate both Kelly and Rebecca sharing some about their experience today. We enjoy so much our opportunities to learn more about the local systems of care and the work that's happening and all the wonderful work that's happening locally in each of these communities and at the state level. And we're excited to see how Family Connects integrates with that work and supports that work moving forward. So thank you.
Thanks, Ashley. This is Kate again. I just really want to also echo our thanks to Rebecca and Kelly for sharing what they've experienced so far. Like I've said from the very beginning, this is a journey. There's going to be lots of bumps in the road, and one of the main reasons for these early adopter communities and their interest in moving this forward was to really learn as many lessons as we can as we're implementing this program. And so I really appreciate your honesty about what's working and what's not, and what are some of the continuing barriers. And as we move through this journey, we're going to be identifying more and more of those and surfacing them. But it's going to take all of us collectively to be able to figure this out and to move this into a statewide program. Just to remind everyone, we are the first state to move this to a statewide program. We're going to be doing this over 6 years. We are also the first state to have legislation that requires that we have this program in Oregon. So, and I will say that the rest of the nation is kind of watching us. So I appreciate that, and I also want to make sure that we are as transparent and honest about what works well and where do we find some issues that we need to address and barriers, so that we can collectively work on those and then share those lessons learned with other sites across the nation that are also interested in doing this. So kudos to you all for being those out in front and leading the way.
We have one last question. Will this be an ongoing webinar, like a community of practice for early adopters? It is an ongoing webinar. Our plan is to do these updates for people who are interested. They're already up to date quarterly. As far as it being a community of practices for early adopters, I think it's good for the early adopters to be talking and learning from each other. We're excited to learn from each of you, but this particular webinar is more focused, I think, around a broader interested parties.
I do them quarterly. We might want to reiterate that.
Yeah, so these will be done quarterly, these update webinars, and we will let you know about them through that distribution list. And if you have any questions, you can email us at that email address that's on the screen. We don't have any other further questions.
All right. right. Well, thank you to Kelly and Rebecca and everyone who is there at the OAJ office. Derek, thanks for organizing all the work that went into getting this update, this webinar all planned so that we could provide updates to people who wanted to jump on and hear what's happening. Also, thanks to our team from Family Connects for being available today on this call to answer questions and be here with us. I just want to thank everyone for their time. Lots of hard work going into this, and just reiterating what Kate said, it's really exciting work, and we're kind of figuring it out together, which I think adds to the excitement and collaboration of it. And it's excited to see how each community really takes this on and how it goes. So thank you everyone for your time. And I think, Derek, if there weren't any other questions that popped in the last minute or so, then I think we'll wrap up.
I think we're good. Thank you.
Okay, thanks everyone. Bye.
Thank you.